Giving my child meds was not something I expected when I was pregnant with her. When I dreamed of raising my children, I did not insert giving 6 medications morning and then 6 medications at night and then a few meds during the day. I never had that in my expectation. I never thought that that could be a daily habit, but now it is, and it has been for the last 3 years. My daughter has gotten seizure medications, rescue medications, constipation meds, you name it. And I have had to learn how not only to be comfortable with medicine, but also to give dangerous medicine to my daughter. Having the responsibility of giving my child medication that could potentially harm her is a very, very scary thing. However, you are not alone if you're in that situation. And as parents, we can use what we've learned and we can help each other to do this properly. Never underestimate your capability to learn how to read medicine bottles, to learn how to use syringes, to know how to give your child medication. But allow yourself to feel. If you haven't had a moment to mourn the fact that your toddler is getting medications or your 15-year-old is getting medications, please let yourself be uncomfortable, cry about it, feel sad that you can't just give your baby Motrin or Tylenol when they're teething. You've had to give your child so many things since the very beginning. Allow yourself to feel it, allow yourself to mourn, and let that energy empower you to be a smart, capable, responsible parent. Don't allow society to dictate what kind of parent you're going to be. Be the parent that takes care of your child, knows their medication better than their doctor. In this next video, I am going to go over with you how to read a medicine bottle, the different types of syringes there are, how to draw meds, or how at least we draw meds, and then an example of connecting the G-tube extension to the patient and also giving them meds. This video is for G-tube children. So if your child has a G-tube, then this video is for you. This is an example of different types of syringes. So we've got 2 different brands here. We've got the lids and we've got different sizes. Depending on what your child needs, you're going to use one of these syringes. My daughter was prescribed a drug called memantine. See, it says 2 milligram dash or bar ml solution. What does this mean? This means that there are 2 milligrams per ml. Always take this and interpret it as per. Then it says give her 3.75 ml twice a day. So how many milligrams am I giving my child every single day? What we're going to do is we're going to take this number and multiply it by this number to get what milligrams you're giving her per dose. And yes, we're going to do this the long way, because why not? 750 milligrams twice a day. So that means you're giving your child 15 milligrams of that medication per day, and all you're doing is splitting it in half. So if your doctor asks how many milligrams, you now know that your child gets 15 milligrams of that drug a day. And that is what medical math looks like. Right now, I am going to get my daughter's evening meds together. So she gets about 5 meds at night, 5 in the morning, sometimes 6 depending on if she needs painkillers. So we have decided to do the medicine cup way. There are different ways to do this, like a milk straw, an adapter, etc. But this is just found to be the easiest and most effective for our family. So I'm going to show you what we do. Senna is a medicine. It's like a natural supplement to help constipation. This is a home syringe. We've used this several times. This is a 3 cc, 3 ml syringe, okay? She's gonna need about 1.5. So it's gonna be about half of this syringe. And as you can see the dashes, there's always one big one, 2, 3, and there's small dashes. So that'd be like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So she's gonna get 1.5. So I'm gonna fill it to this mark. You insert the cap of the infant, then you're gonna pull up, and we're gonna go to that 1.5 mark. If there are a lot of air bubbles, you can just slightly push, like this. Then we pour the solution back in. The reason why this method is sometimes really ineffective is because of really gloopy medication, but we've learned to deal with that, and it's never been a big problem for us. This is a seizure medication, which sometimes they do not have the oral solution for this, but we've been blessed to have the oral solution. If you have the pills, you're gonna have to use it with water, but this one's pretty gloopy. This one's gonna be 2.1. So again, we're gonna use a 3 cc syringe. We're gonna pull up, and yeah, there's gonna be air bubbles in this one because it's so gloopy. So what I do is I pull it up to like 2.3, 1, 2, 3, see that? And then I'm gonna hit it with this. The goal is when you tap it like this, is to get the bubble all the way to the top. Then we're gonna slightly push to get that air bubble out. Boop, like that. And we have 2.1. So it's at that line right there. There's 10 cc's in between the big line and the big line. So we're gonna do 2.1, okay? You especially wanna make sure that it's the correct measurement if you're giving something like Ativan. This is a more liquidy medicine. I'm gonna pour a little bit of that. Work. So as you can tell, the difference between these two, there's a small one and a big one, right? This one's wider and longer. So she needs 4 cc's of this. So we're gonna give about half of this. This is a 6 cc syringe this time, a 6 cc syringe. So we're gonna give her about 2/3 of this. We're gonna insert, pull. Now there's a bubble, see that bubble? So I'm gonna fill it to like 4.3. I'm gonna tap the side of the bottle. I'm gonna put that, if you move the bubble so that it's right there, then you can push. You'll get the air bubble out. And okay, so this is 4 cc's. Then this one's tricky. This one is 3.8 cc's. So we're gonna pour the solution in there. Gonna grab a 6 cc syringe again. So this 6 cc syringe is bigger than the 3 cc syringe, okay? It's gonna have more volume. We're gonna insert. We're gonna pull almost to the 4 line. So again, there are 10 lines between the 3 and 4, okay? So it's gonna be a little tricky, right? You gotta use your eyes a little bit and see that there's a long dash, see, long, and you count 1, 2, and you make sure the black line is right there at the second line to the 4, okay? Then there we have 4. This one doesn't make a lot of air bubbles, so we're gonna put that one down, all right? Then we have melatonin, which is a supplement. So for this type of thing, it says 1 milligram for 5 ml. So she's prescribed 1 milligram. If you get milligrams and mLs mixed up, it is gonna be a long, hard life. The sooner you learn it's different, the easier life will be. All right, we're gonna grab another 6 cc syringe. This time we're gonna do 5, okay? But again, this one is a supplement. This one isn't as dangerous, right? So if I accidentally give 4.5, it is not going to hurt your baby. I'm gonna pull it all the way up. This syringe is a little older. I can tell by the way it has a lot of like pressure as I pull it up. I'm gonna get rid of that little air bubble. There we go. I'm gonna pour it back in here. All right. So now we have our 4 medicine, but what are we missing? We are missing a flush. So what I'm gonna do is I'm gonna go over here I'm gonna get some water. And pour a little water in there. I'm gonna use a 12 cc syringe this time, and see how that's overlapped? All you do is you kind of just pull it out, see? Then you push it back in. That just means it's a little older. I'll take this, and this is just water, right? So you can fill it all the way up. The extension set is about 10 to 12 cc's. Okay, so now we are ready to give her nighttime meds. I am about to start feeding my G-tube dependent daughter. This is the Mickey extension. We change this out about every week. So what you're gonna do is, she's in her chair. So we're gonna find the G button. Right there, peekaboo. And yes, the patient does try to grab the extension. We take this part right here and find the G button, which is right there. What you're gonna do is you're gonna line up, you see how it has that dash right there? You're gonna line up the dash with the dash in the actual button. You're gonna press till it goes all the way in. And as you can see, we're gonna lock it by turning it clockwise. And then, in order to not prevent clogging while you're trying to feed them, I am going to twist the G-tube like this. It does not hurt your child. If she's having irritation, it will, but that's why you clean the G-tube every day. We close it, and then in order for Paige to not grab it, because we all know she likes it, we put the buckle this way. And we're gonna put her desk on like this. And I'll be able to access the G-tube extension right there. All right, this morning I have Paige's 5 medications that she takes in the morning. As you can see, I have the infant syringe. I've already drawn them out, and I just need to connect them to the patient and give them to her. So, as I made in my first video, the extension set is already attached to her. I made it easy access, so I can now access it. What you're gonna do is, you're gonna unscrew one of them. See how that locks? This has a screw, this has a screw. Insert, turn clockwise, unclamp, push, clamp, unscrew, next one. Insert, screw, unclamp, push, clamp, unscrew, next one. Insert, turn, unclamp, push. That's elderberry. Unscrew. Next, insert, screw, unclamp, push, clamp, unscrew. Next one. Insert, screw, unclamp, push, clamp, unscrew. And now I'm gonna put the cap back on and I'm gonna go get her food. Don't be ashamed to be Dr. Mom.